Hi, House Democratic Leader Christine Greig here. It's been a little while since I've given you some update, but things have really heated up in the last 2 weeks here in the legislature. Just like in other places in the country, we've seen attacks on women's health care. We had a couple of very contentious bills that were adopted by the House and Senate last week, banning specific medical procedures that doctors can use to terminate a pregnancy because of health reasons or any other reasons. And why the legislature thinks that they are doctors and should be able, and telling doctors what's the best for their patients is just beyond me. I voted to oppose both of those bills. We also, on a more positive note, celebrated Equal Pay Day today. The Progressive Women's Caucus and the Democratic members of both the House and the Senate have been working for years to bring education awareness to the issue of the gender pay gap. Across the board, women are paid about 80% of what men are paid. And then when you go to women of color, it is just dismal. The gap grows quite a bit. And there's a lot that we can do here in the state to help make sure that everyone is paid fairly and equally for equal work. Then we also, of course, you've probably heard in the news a lot, we're taking up no-fault auto insurance reform, I should say, and that's, again, very contentious because we have a very unique system here in Michigan where regardless of your employment, regardless of anything, if you are in an auto accident, you have an insurance policy to make sure that you have the health care that you need, the rehabilitative services that you need to make sure that you get back to a quality of life to recover from such an auto accident. And that system is under attack right now. Now, everybody agrees that Michigan's auto insurance rates are too high. And the House Democrats have put together a plan, it's called DRIVE, it's putting the drivers back in the seat, where we look at different reforms in the system before we start reducing access to health care. So we're working very hard. We believe that by growing the pool of the number of people insured by the system, we can reduce costs across the board. We also want to make sure that we end discriminatory policies. It shouldn't matter your zip code that you pay 2-3 times as much for car insurance. Then the other big topic that we're tackling right now is the budget. Now, we've been working on this for months, and so far we have not seen any realistic or actually any plan for the Republicans on how to fix the roads. We've seen study after study saying we need more than $2 billion more a year to fix our roads, to get 90% of our roads up to good condition. So we're waiting on the budgets. That one lever to increase more revenue takes care of our priorities for infrastructure and education as well. So as that progresses, we'll give you more details on that. So that's it for Under the Dome this week. I'll talk to you soon.